Yeah. Uh, Hello, everyone. Thank you for joining me on this session on public awareness on organ donation. So, before we start, let me introduce myself. I'm Dr. Chandra Sekhar, Senior Consultant Critical Care at KIMS-Saveera Hospital, Anantapur. So, as you all know, so by definition, what is organ donation? Organ donation is giving of an organ or a tissue to help someone that needs a transplant. As you know, there are a lot of people around the world, youngsters, including youngsters, who have had failures of their kidney, liver, due to various reasons. It can be because of any reason. But when they go into a failing organ, so that is when they require something called transplantation. Transplantation is when an organ is taken from somebody who doesn't need it and it is kept in the person who needs it. So that process is called transplantation, and it is done through a surgery. So the people who donate organs are called organ donors. So as you all know, India ranks almost, unfortunately, almost number one among the number of road traffic accidents and number of unfortunate deaths that happen. So considering that, our status of organ donation is very, very poor. So, but if we see the numbers of the organ transplants that have evolved from 2013 to 2022, so the number of kidney transplants that used to happen in 2013 was around 3,595 from a living donor and 542 from a deceased donor. A deceased donor is somebody who is brain dead. So technically, brain death means his heart is still beating, but his brain is completely non-functional, and it is proven with a series of tests, and it is confirmed by specialists, including the critical care physicians, the neurosurgeons, and the neurologists. After performing certain tests called the apnea test, EEG, and sometimes the transcranial Dopplers. So once these tests are done and the brain death is declared, they are called the deceased donors. So the deceased donors, kidney transplants in 2022 from the deceased donors are around 1,500. And coming to liver transplants, in 2013, from living donors, it was around 658. And in 2022, it rose to close to 3,000. So the number of transplants have been evolving. However, sadly, there is a massive increase in demand. So when you see the magnitude of organ transplant that is required, nearly 5 lakh Indians die every year due to unavailability of organs. So, and this is very, very uh, sad to hear that almost 2 lakh people die in need of a new kidney, and almost 1 lakh people die in need of a new liver. So this is a very big and unfortunate number to hear, and it pains a lot because it's not only the person who is involved, it's also their family that is at loss because of lack of availability of the organs. So as on March 2023, approximately 1,20,000 people are still waiting for organ transplantation. These are people who are registered with specific organs or specific organizations or the hospitals, and who are in need for organ donation. These are people who are actually registered, but if you actually see the total number of people who are not registered, it's much more than that. So just for common public awareness, so what are the organs that can be donated and transplanted? So the common organs that can be donated, so there are two types of donors, as you have already seen. One is the live donor, means a person who's most probably the first degree relative, the mother, father, or from a son, daughter, or brother, sister. So these become the first degree relatives. Or sometimes if the husband and wife, if their uh, parameters match, then probably wife or husband can be donors to each other. So these are called usually the live donors. So the organs that can be taken from the live donors are different, and the organs that can be taken from the brain dead organ donor are different. So the organs that can be taken from the brain dead donor include the kidneys, liver, pancreas, heart, lungs, intestine, and uterus. These are the organs that can be taken. But when you see the tissues that can be taken, it's much beyond that. So the tissues include our eyes, the cornea, the bone marrow. So you see the bone marrow transplantation, especially in people with tumors and people with advanced stages of blood cancers. So bone transplant and tendons, skin, heart walls, ligaments, cartilages, blood vessels. Blood vessels is nothing but all our veins. So nerves, hands, and face. So these many tissues can be uh, transplanted from a brain dead organ donor. So coming to the ones that can be donated from a regular donor, means a live donor. So live donor can donate one of their kidneys, a portion of their liver for people requiring liver transplant, and gestational tissue. Gestational tissue is nothing but the leftover tissue after the birth of a newborn. So once a pregnant mother delivers a newborn, so after the complete placenta is removed, the tissue that is left is called the gestational tissue. And in rare cases, maybe a part of the lung and pancreas or the intestine has also been uh, used for organ donation in a live donor. However, there are very, very few cases of this. So just to summarize what can be donated. So starting from eyes, the cornea, lungs, the heart, liver, pancreas, bone, veins, kidney, small intestine, the skin, and the cartilage. So what does the law says? So organ donation laws have been very strict in a country like us, especially because there is a lot of organ trades and a lot of news about the organ trades and all. However, there are strict rules and organ donations are legal by Indian law. However, there are set protocols and set rules that should be strictly followed to avoid any cases of misuse of organs. So um, there have been strict laws. The first has been started by the Indian government in 1994. The Indian government started the Transplantation of Human Organs Act in 1994, and later they have formed a complete organization under the Government of Health Affairs. They have started the National Organ and Tissue Transplantation Organization, so NATO. So it's a national level organization that is set up directly under the supervision of the Directorate General of Health Services, Ministry of Health and Family Welfare, and the head office being located at New Delhi. So this is an organization which completely establishes the set of protocols and the rules and the regulations that are required for the procurement and the distribution of organs and tissues anywhere in India. So these acts have been last modified in 2014, and every amendment is being circulated among the complete group of registered hospitals. And the laws have been particularly very strict, especially with regards to organ trading or any mischiefs like that, because this is something which is very noble and it has to be completely treated with utmost sanctity. So because an organ donation can save up to 8 lives. So when you're saving up to 8 lives, sanctity has to be maintained. So there are lots of myths that have been saying that, okay, people who are rich get the organs early. No, the rules and the organization, the NATO, have been very vigilant and have been very strict when it comes to rules like this. So nobody can bypass the register, no matter how much ever somebody tries to influence or how much ever somebody tries to pay. Nobody can bypass the registers and nobody can bypass the laws. So how can we register for an organ donation? Since we have seen the magnitude of requirement of organs, how do we as common people register for organ donation? So as I have said, Noto, this is the dashboard and the opening page of the Noto, which completely says how to proceed. So This is like any other website, and it's most of the things are self-explanatory on it as to how you have to register. And it shows the complete data of people who have registered, and it shows the complete data of category wise registration. Suppose how many men have registered, how many women have registered. So these organizations clearly state that anybody who is above 18 years of age can register their name, and they can also specify the organs that they want to donate. It's not necessary, and it's not essential that you are willing to donate all the organs. No, it's not required like that. So in case you want to donate only your lungs, you can specifically mention in the register saying that you want to donate only your lungs. Or if you want to donate some other organ like your heart, you can specifically. In case you're okay with donating your entire organs, you can clearly mention in that. So anybody over the age 18 can do this. Pertaining to the states, so yeah, both the Telugu speaking states, the government of Andhra Pradesh, Jivandan, and the government of Telangana, Jivandan. So Jivandan is basically the organization taking care of the entire framework of organ donation in Andhra Pradesh and Telangana. So these are their complete dashboards. So when you open those dashboards, you have the complete set of information as to how to register, how to register our name, and like I've told, how to register for a particular organ. And if you are above 18, you can give the consent for the organ donation. And there were a couple of important things to remember, and there are a lot of myths, of course, but anybody who is interested in donating should completely go through these two websites, the Noto and the Jivandan, so that all their myths are cleared, including there are some questions like, okay, will the hospital ill-treat me in case I register my name for organ donation and something really big like road traffic accident happens to me? No, it never happens like that, because only after your brain death, and your brain death is completely certified by registered doctors, then only under the supervision of Jivandan, the organ donation can happen. So some of the important points to remember is, though you have registered your name under Jivandan for voluntary organ donation after your death or after your brain death, it becomes mandatory for your kin to give a consent again. So even if you have given a consent for, or even if you have registered, it is mandatory for your kin to authorize that or give a consent again. So it is very important that when you are registering such things, it is very important that you discuss with your family of the complete details and complete things that you want to register. It is important that you convince them, you take their consent, and then go ahead, because tomorrow, unfortunately, if something happens to you, the family also has to give consent for the organ donation. And one more important fact is, after removal of the organs, how long can we wait? So there are standard set of rules. So for a brain dead organ donor, so once the brain death is declared and the organ donor is identified, so the Jivandan, according to their list of waiting candidates, will allot where the particular organ has to go, along with the complete channel called a green channel. Green channel is something created by the Jivandan and the respective police departments of their states or the districts for a complete and uninterrupted movement of the organs to the recipient site. So heart and lungs usually should be transplanted within 4 to 6 hours. Liver lasts for 12 to 20 hours. Pancreas for 12 to 24 hours. And kidneys for 48 to 72 days. So these are some of the important facts to remember. But for somebody who wants to donate, I suggest you should go through the entire website of the Jivandan as well as the Noto, and be completely aware. So I wish you all join us to save lives. Thank you for joining.